Hey, it's Atch back with another health highlight from Michigan Primary Care Partners. Now, this week we're talking about something that might hit a little close to home, as many people suffer from it, or your kids might suffer from it, or you yourself might. Now, I know personally, in my household, we have an issue with it. I'm talking about gluten sensitivity and celiac disease. Now, you hear a lot of people talking about, oh, I'm on a gluten-free diet, I have issues with my digestive tract, but do you really know if you have one, or are you just kind of saying, I think I might? Same with your kids. Do you actually know or not? So we're going to dive into that this week. I know personally in our household, we have an issue with gluten, and my fiance deals with it on a daily basis, and it can be quite troublesome a lot of times if there's just one thing that is added to the diet that might just upset the stomach. So what does that look like? What is something that you can do for yourself? What's the difference between celiac disease and gluten sensitivity? Also, what are the symptoms? And how can you get tested to figure out what are some gluten-free things that you can get in your life that might alleviate some of that pain? These are the things that we're going to talk about. Also, when should you seek care? This is how Michigan Primary Care Partners can help you decide what is the right path of action for you in this week's Health Highlight.
So there's a lot of talk about gluten in this day and age. We have all these gluten-free diets. We have all the restaurants that are coming out with gluten-free menus and items. So a lot of people are starting to wonder, is gluten bad for me? So gluten is not necessarily bad for you. And some people will eliminate gluten from their diet and they think that they feel much better. Well, the real reason behind this for most patients is because gluten can be present in a lot of processed foods, stuff like that, hamburger buns, you think about bread that gluten can be in. So sometimes when you eliminate those things, of course you're going to feel better, you're eating better. So gluten sensitivity specifically does have the same symptoms as celiac disease. You get the abdominal pain, the cramping, the bloating, the diarrhea. But the difference between the two is that celiac disease, when you're ingesting gluten, you're actually causing harm to your body. In celiac disease, when you ingest gluten, your body elicits an autoimmune response and actually attacks the cells in your small intestine. So it's important for people with celiac disease to not consume any gluten at all. So if you are finding that when you consume gluten, you are having symptoms like the abdominal pain, the bloating, diarrhea, it is important to talk to your internal medicine or family care provider about this to make sure that you aren't actually doing damage.